Let's talk about the common cold. So the common cold is also known as an upper respiratory tract infection. And what it is, it's a viral infection that can be caused by really hundreds of different viruses that like to infect the upper airways. And the upper airways include the nose, the throat, the mouth, and the lining of the larger tubes in the lungs. You know the symptoms of these because you've all had one before, but nasal congestion, cough, runny nose, malaise or the feel bads, fever. But what you may not know is the duration that I expect for all these symptoms. So I expect the brunt of symptoms with any cold to be about 2 to 4 days, and it really shouldn't linger much longer than that. And that would include things like the fever or not feeling well, or really kind of the peak of those symptoms. But what you may not know is that I expect congestion and cough in particular to last up to 3 weeks after a single viral infection. And that's just based on the way the viruses create mucus and the way that your body clears that mucus. So a lot of people come into the office with cough following a viral infection, and we often tell them that's kind of what I expect based on the way your body's dealing with this illness. When it comes to treatment, there's really no magic bullet or antiviral medicine that can help clear these viruses more quickly. So our treatment is geared at symptomatic care. So things like Tylenol or Motrin for fever or not feeling well. Remembering that you have to be at least 6 months old to have Motrin. You can have Tylenol younger than that. In terms of cough, honey is by far the best cough medicine that we have, and it actually outperforms any of the over-the-counter cough medicines that we have. So really, it's the only medicine that I recommend for cough. You have to be older than 1 year old to have honey for cough, just because there's a risk of botulinum toxin infection under 1 year old. So don't use it unless you're older than 1. Nasal irrigation and nasal suctioning is super important. Not only does your child feel better when they can breathe through their nose, it's going to help them eat, especially if they're still using a bottle because they have to breathe through their nose when they're doing that. But it also prevents some complications, which we'll talk about in a second. And then finally, the most important thing is hydration. So when you and I aren't feeling good, we don't want to eat and drink either, but your body is really working in overdrive. So it's super important that your child continues to drink. Couple of things that may help for a child that doesn't want to drink are, instead of doing large volume bottles, try smaller volume ones more frequently to see if you can get that same volume just spread out a little bit over time. And then second, they may not want milk. It sits heavily in the stomach and they're not feeling very good. So try something like Pedialyte, which has both sugar and all the electrolytes that your child might need to keep them replenished during the illness. So let's talk for a second about complications. So the vast majority of viral infections will get better on their own and not cause any problems. However, the majority of ear infections, pneumonias, and sinus infections actually start out as viruses. And really that happens for a couple of reasons, but the biggest one is that viruses like to create mucus, and bacteria love to eat mucus, and that's what helps them propagate to form those bacterial infections. So signs that a secondary bacterial infection may have gotten in behind the illness are if that fever lasts more than that 4 days that we talked about in the beginning. That would be unusual for a virus alone. So we should take a look for one of those bacterial causes. Or if your child seems to be getting better, but then all of a sudden gets sicker again, either the fever comes back or the cough gets worse or that malaise kind of returns. Those are all things that make me a little bit suspicious as a secondary bacterial infection as well. So those complications from the viral infection, the pneumonias, the ear infections, the sinus infections, are caused by a bacteria and can be treated with an antibiotic. But it's important to know that viral infections do not respond in any way to antibiotics. So there's really no role or no utility in treating a viral infection with antibiotics. It just doesn't work that way. So my hope is that you gained a little bit of information about the common colds and maybe learned some things that you didn't know before. If you have any questions or concerns or want to learn more, give us a call at the office and we'll be happy to talk with you. We'll talk to you soon.